In today's health alert, the CDC is reportedly considering ending COVID-19 isolation guidelines, though the agency has provided no official confirmation. So here with more is our chief health editor, Dr. Partha Nandi. And Doc, what's going on here?
Yeah, so Brian, currently the CDC recommends that people who are infected with COVID-19 isolate for 5 days, right? But however, according to press reports, unnamed agency officials said that individuals with mild COVID may soon be able to end isolation if they've been fever-free now without the help of medication for 24 hours. Also, their symptoms must be mild and improving. Again, it's important to note that the CDC has not updated its COVID guidelines and said they have nothing to announce at this time. But as for when this might happen, press reports say that discussions are at early stage, but come April or even late spring, the CDC may release new guidance on public feedback. Remember, COVID has not changed, Brian. It's still contagious, dangerous for many folks. That's deadlier than the flu, and people can suffer from long-term effects. But what's changed is really people's attitudes. Isolating for 5 days means people miss out on work or school, even if they're only mildly sick. Then this can discourage testing, which places some people at risk of getting seriously ill if they don't seek treatment.
Well, we know that there's an example that we can look to that kind of gets in the same ballpark as what this potential recommendation is, right? Oregon broke away from CDC recommendations last May. Have they seen more community transmission?
That's a good point. So Oregon Health Authority, Brian, recommended that instead of isolating for a specific number of days, that folks stay home until they've been fever-free for 24 hours without medication and symptoms are getting better. Now, they also advise wearing a mask when around others for 10 days, which aligns with the CDC's policy. But since this change, Oregon has not seen a significant increase in community transmission or severity, according to health data. When looking at national data, Brian, we currently have about 20,000 individuals hospitalized. About 2,300 folks are losing their lives every week due to COVID. Now, the number of deaths is much lower than 2021, which is also the last year the CDC updated its COVID guidelines. But this also means that too many people are still dying from this virus, right? And that new guidelines must be well thought out, especially for vulnerable groups like the ones who are age 65 and older and people with weakened immune systems. On the plus side, hey, our vaccines, we talk about this a lot, are still working. Research show that 54% are effective in preventing symptomatic infection in adults, 54% effectiveness. So that's good. Additionally, treatments like Paxlovid have been proven successful, reducing COVID-19 related hospital admissions or deaths by about 88% compared to placebo. So whatever decision I feel the CDC makes regarding guidelines, they will carefully weigh the pros and cons, relying on evidence and science to really help ensure the safety of our communities. I still think be vigilant and remember it's not just about us and our safety, but those around us who may be more vulnerable.
Yeah, always got to keep that in mind. Dr. Nandi, as always, grateful for your expertise. Thank you.
Thanks, Brian.
And if you have a coronavirus question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com or send it to us on Facebook.